Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. High neutrophils, low neutrophils, and what they mean. High neutrophils and low neutrophils can be caused by certain health conditions, medications, or medical treatments. Called neutrophilia, high neutrophils can mean you have an acute infection or injury. Low neutrophils, called neutropenia, may be caused by chronic infections or autoimmune conditions. /r/n/r/n In rare cases, low or high neutrophils can be a sign of something serious, like cancer. /r/n/r/n Neutrophils are a type of white blood cell. They can become high when they leave your bone marrow to help combat an infection. Low neutrophils happen when there is decreased production or storage of these cells. /r/n/r/n Illustration by Laura Porter for Verywell Health /r/n/r/n Neutrophils are a type of white blood cell that make up part of the immune system's frontline defense. Approximately 40% to 60% of all of your white blood cells, WBCs, are neutrophils. A normal neutrophil range for a healthy adult is between 2,500 and 6,000 neutrophils per microliter, L, of blood. /r/n/r/n Neutrophils are produced by bone marrow, but they can be found in the blood, tissues, and lymph nodes throughout the body. Neutrophils have a lifespan of less than 24 hours, but your body makes about 100 billion of these WBCs every day. /r/n/r/n Among their many functions, neutrophils protect you from infection. As part of your innate immune response, neutrophils are one of the first WBCs to arrive on the scene when you get a bacterial infection. /r/n/r/n Neutrophils are classified as both granulocytes and phagocytes. By definition, /r/n/r/n if you have high or low neutrophils, you may experience symptoms related to the infection or other condition that is causing your neutrophil levels to be high or low. For example, /r/n/r/n high neutrophils are known as neutrophilia. Neutrophilia can be categorized as being either primary, caused by a congenital disorder or disease of the bone marrow specifically, or secondary, caused by infections, inflammation, stress, and other medical conditions. /r/n/r/n Causes of primary neutrophilia include /r/n/r/n Causes of secondary neutrophilia include /r/n/r/n Infections are more likely to cause high neutrophils if they are bacterial infections, though viral infections can also cause neturophilia, especially in the early stages. Fungal and parasitic infections can also cause high neutrophils. /r/n/r/n Neutrophilia is common with severe COVID-19 infection. While the high production of neutrophils is the body's way of fighting the infection, the excessive activation of neutrophils can trigger an immune overreaction called a cytokine storm. This can lead to the formation of potentially life-threatening blood clots, including deep vein thrombosis, DVT, and pulmonary embolism. /r/n/r/n Low neutrophils are called neutropenia. A decreased neutrophil count could be due to /r/n/r/n An absolute neutrophil count, ANC, is part of a battery of tests known as a complete blood count, CBC. This may be done as part of a routine exam or to help your healthcare provider diagnose certain conditions. /r/n/r/n The ANC is calculated by multiplying the total number of WBCs by the combined number of mature neutrophils, called segs or segmented cells, and immature neutrophils, called bands. /r/n/r/n If the ANC is higher or lower than the normal range of values between 2,500 and 6,000, further evaluation will be needed to help determine the underlying cause. /r/n/r/n Absolute neutrophils are considered high when they are above 6,000. This may be due to a number of mechanisms that increase the number of neutrophils in response to various diseases or circumstances. /r/n/r/n examples include /r/n/r/n. Although high neutrophils can be a sign of leukemia, there are many other medical conditions that can cause your neutrophils to be high. /r/n/r/n neutropenia is when your neutrophil levels are less than 2,500. A level of less than 1000 is the most serious and can increase the risk of infection. /r/n/r/n symptoms of neutropenia can vary but may include fever, chills, fatigue, sore throat, mouth sores, cough, shortness of breath, skin sores, painful urination, or diarrhea. /r/n/r/n several mechanisms can result in a low neutrophil count. /r/n/r/n there is no one way to lower your neutrophils. Your neutrophils should go down with treatment for the condition that is causing them, or as your body naturally eliminates the source of an infection. Some of the ways the conditions that cause high neutrophils might be treated include :/r/n/r/n. There are times when neutrophilia or neutropenia cannot be avoided, such as with certain congenital disorders and chronic diseases. Even so, there are ways to better maintain neutrophil levels to fight infection and remain healthy. /r/n/r/n neutrophils are a type of white blood cell, WBC, that play a key role in fighting off infection. Your level of neutrophils in the blood can change, depending on a number of factors, including infection, stress, chemotherapy treatment, or nutritional deficiencies. /r/n/r/n in some cases, your neutrophil levels will be high. This condition is called neutrophilia. In cases of neutropenia, the level may be lower than dangerously low. Your healthcare provider can begin with blood tests and move forward in diagnosing the cause of any neutrophil level changes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.